Now with a segment, here's our reporter, Laura Windsor.
If you are bothered by signs of aging in your face, facelift surgery may be right for you. We spoke with Dr. Anil Punjabi at Redlands Community Hospital about the benefits of undergoing a facelift procedure.
Plastic surgery can help almost everybody. There are certain limitations though. I mean, obviously the canvas that you're presented with has some limitations, and what we can accomplish is tremendous. Now we do face transplants. So, almost everybody can be helped to the extent that is present on the canvas. You cannot, of course, completely turn back the time 30 years ago for a person, but you can definitely take 5 for sure and definitely 10 years off.
Dr. Punjabi describes the changes to the face as it ages.
The changes of age, affect several different areas. They affect the skin, obviously. They affect the fat, which is underneath the skin. They affect a little bit of the muscle, which is below that. And they, of course, affect some of the bone. The skin, of course, gets more sun, actinic damage as time goes on. Fine wrinkles and crow's feet develop. You have then, of course, the descent of the muscle or fascial layer below the skin, along with the fat, which creates hollow areas, creates bulges in areas that you don't want them to bulge, like the jowls. And you then, of course, also have a little bit of bone loss, which actually causes the face to look a little bit sunken.
Dr. Punjabi explains the facelift procedure.
The operation for a facelift takes about 3 hours. It depends again on what components you are trying to correct. The fine wrinkles that patients have, they cannot just be corrected by just tightening up the skin. They need to be treated with a laser, for example. The area below the skin, the fat which has kind of been lost with time, sometimes you have to refill that. You have to volumize that. You have to restore the volume that has been lost by borrowing fat, say from the tummy or from the thighs, and then injecting it in the hollow areas around the face. And of course, then the muscle or the fascial layer that is below that needs to be tightened up also, so that the foundation for the skin is also restored, not just the skin, because once you just tighten up the skin, it will loosen up again in a few months or a year's time. But if you actually also create the foundation for the skin to sit on, and that foundation is also rejuvenated and repositioned into its correct anatomical place, then the skin will have a much better chance of staying and appearing very rejuvenated and young for 5, 10, sometimes 12 years.
Dr. Punjabi tells us how he feels after seeing his work.
Plastic surgery is as much of an art as it is a science. It does have certain principles that you have to follow. And then with those principles, you can expand your art to whatever level you want. It is a very life-changing for both the patient and for us. We love what we do, most of us. And it is pure delight just to come and work every day. There's no question about it.
Looking youthful and rejuvenated after a facelift is the best result you can achieve, especially when you look as good as you feel. For the American Health Journal, I'm Laura Windsor.